One thing I ask all my breast enhancement patients is what they're hoping to accomplish. What cup size are they hoping to accomplish? And I've noticed in the 20 years that I've been in private practice, there's been some cup creep over the last 20 years. Going from back when I first started off in the early 90s, it seemed the majority of patients, they wanted to be I want to be a full B or maybe a small C, and the C cup seemed to be the goal at that time. Now, the C cup is still the average goal, but mostly it's now I want to be a full C or a small D. Now, have American women changed all that much in the last 20 years? I really don't think so. I mean, American men and women have been obsessed with breast size for as long as anybody can remember. I mean, Mae West back in the 20s, Jane Mansfield, Jane Russell, all these kind of curvy actresses became this cultural ideal of what was attractive. So why did we go from B cup to C cup to now D cup? I blame the bra manufacturers, actually. I think that they're messing with patients in that I think now what was a C cup probably 20 years ago is labeled a D cup. So as part of my educational efforts for my patients, I tell them to tell me what cup size they're hoping to accomplish, but don't have a preconceived notion of what cup size they're actually going to wind up being, because that really depends on what breast or what bra manufacturer they choose. If they go to Nordstrom's, they might get measured out as a C cup. If they go to Victoria's Secret, they might get measured off as a D cup. So a lot of it depends on who's measuring you and who's making your bra. For example, this is a 375 cc implant. In my practice, it's neither a very small or a very large implant. It's very average. I had a young patient, about 5'5", 5'6", come into my office wanting a breast enhancement, and we put this implant in her. She wanted to be a full C, possibly a small D, and at her post-operative visit, I asked her what cup size she was. She said, well, I'm a 32 double D. And I said, no, you're not. She goes, well, yes, I am. That's what the bra says. And I go, well, yeah, that's what the bra says, but you're really not a double D. Double Ds come into my office to get breast reductions. So, do you feel like you need a breast reduction? No. Okay. If I had told you you were going to wind up a double D after your surgery, would you have had the surgery? Oh, absolutely not. So basically what you're telling me is your bra says you're a double D, you don't feel like you're a double D, but you feel curvy and proportional. Is that right? That's right. So I think women really need to get out of this mindset of being dead set on a certain letter of the alphabet for their post-operative results. They need to decide if they want to be proportional, they want to be curvy, or if they want to be over the top. They should make that clear to their surgeon. Their surgeon should really ask them these sort of questions so that we can avoid the far too common case where the patient wishes that she had gone bigger. Another way you can help your surgeon is by bringing in copies of pictures of breasts that the patient finds attractive, a certain size. It has to be obviously on the same frame of patient, but it will also tend to give the surgeon at least some input on what that particular patient finds attractive. All too often I've had patients tell me, oh, I want to be a C cup, but the pictures that they show me are clearly not C cups, which makes me fudge a little bit on the larger implant size.